Okay, perfect. All right. So the first poll is going to ask you which region you represent. We've been trying with a lot of outreach to make sure we have representation from across the state. And so we're happy to see where you're at. And I'll be able to share this with the group. So I'm going to go ahead and launch that poll. And then I'll share these results when we're done. Give everybody about a minute. And I do see that we have a hand raised. I see your phone number is 720 ending in 306. Would you like to unmute and let us know who you are? I believe *6 will unmute you if that's helpful. I hear you've come off mute. Okay. All right, we'll just wait for that.
Hello, can you hear me now?
I sure can.
Hi. Okay, I am Renee Franklin with Absolute Expert Care, and I am a non-medical home care owner.
Perfect. Thank you for joining us today, Renee. Happy to have you.
Thank you.
All right. Looks like I've got about 70% of people completed. So I'm going to go ahead and end the poll and share with you all. So hopefully you can see that we have all of our regions represented, which is really exciting. That means a lot of the outreach and stuff that we've been doing is working. But certainly if you see some underrepresentation in some of our other regions and you have connections in the regions, please let us know. We'd love to get these people to the table. All right, let's go on to the next one. The next one is going to ask how you identify on the direct care continuum. I know I had you put it in the chat, but this just helps us kind of see it in one spot, who the individuals are that are joining us today. Give it another 30 seconds or so here. All right, that looks to be about the same number that completed the last one. So I'm going to go ahead and end it for you. Share the results. Mess up my slides. All right, there we go. So really excited. We do have some direct care workers joining us, individuals receiving services, lots of employers, lots of advocates, all my HICPUF team at the government agency. I think some CDLE people are here as well. So excited to have all of you. Certainly the outreach we're doing is changing the dynamic a little bit, and we're seeing a lot more representation across the board. So that's really exciting. All right, last one, I promise. This one just asks how you heard about us. Since we are seeing some difference in the ways that people are joining, either different roles that they're joining from or different regions, obviously something we're doing is working. So we want to see how you heard about us so we can continue to do those things. I'll be quick on this one, I promise. All right, and that is about where we stopped last time too. So go ahead and end, share. Sounds like we got some employers out there that are pushing us. Our advocacy agencies are always sharing information about us too, which we appreciate. John Barry's HICPUF newsletter and communication, he's reaching a lot of people. We love that. And then we have some people who typed others. So if you wouldn't mind sharing in the chat what that looks like for you, we'll go ahead and keep going here. All right. So we are recording now that I remembered, which is great. I have several HICPUF members that are monitoring the chat for us. So if you have questions throughout, you can pop your question in the chat and they should be able to answer that for you. The slides will be posted on the website after the meeting along with this recording, but I do think I'm going to have a team member drop the link to the slides in the chat as well. So you can look at them as we go. Sometimes the size is a little different and stuff, so you might be able to pull those up and make them larger if needed. Again, if you're listening by phone, you can raise your hand, you can tap to unmute. We'd be happy to hear from you. Closed captioning is turned on, so at the bottom of your screen, you should see live transcript if you need that closed captioning. And our website will also be dropped in the link to the chat. And that will be anywhere from past meetings to upcoming events, action group events, and everything kind of information wide for the Direct Care Workforce Collaborative. So. Just a quick overview of who you'll be interacting with throughout this Direct Care Workforce Collaborative and any of the associated action groups. Our co-chair, Penny Whitney, she'll be talking to you here in just a second. And then we have a great group of co-chairs that run our action groups. We have Hope and Pascal for our Value and Awareness Action Group, which will be meeting later this month on the 23rd. We have Andrea and Deborah of our Compensation and Benefits Action Group, which is actually meeting this Friday at 1 p.m. if you're interested. And Lauren and Chrissy of our Training and Career Advancement Group, which we're going to highlight the work that they're doing a little later here in the collaborative. So excited to hear from them. And then we have our HICPUF workforce team. It's a mouthful. Candace, I think, is on the call. She's our division director, my supervisor, Heather, and then the whole team of me, Sam, Jennifer, Tammy, and John. I think they're all here today. If you ask a question, likely one of us will pop in. That's enough of me for now. You'll hear from me again soon, I promise. But I'd like to kick it over to our co-chair, Penny Whitney, to talk a little bit about the overview of the agenda and the collaborative purpose.
Thanks, Brooke. You're a hard act to follow. The phrase, we have a very full agenda, is getting a little redundant, I think, but indeed we do. Looking at today's agenda gives you a focus where we're going. The important thing is to reinforce that work is being done at the collaborative level. From the very beginning of the collaborative in 2020, the idea, we want action, not talk. So today you're going to be looking at some of the action items, and we're excited to show those. You're going to see that the acronym ARPA shows up frequently on today's agenda. I have a few words about that. And so we're going to go through some work that we've done in keeping the collaborative current. We're going to have an initiative on the staff stability survey, followed by the exciting work that's being done by Dr. Judy Scott at UCCS on curriculum development. Then we're going to come back and look at opportunities that are still being offered through ARPA that hopefully many of you will be able to take advantage of. And then especially exciting today, we're having the open forum. Remember that your participation is absolutely key to the success of the collaborative, and we're excited to introduce the open forum. And then Brooke is going to close us out at 11:30. So a lot to do. But as we move forward, one of the advantages that I have as the co-chair is I get to do some reflecting. And Brooke, if you would show the next slide, please. One of the things that I know many of you, and to echo Brooke's welcome, we have a growing stakeholder population. We saw that from our polls this morning, and we're very, very excited about that. But our work isn't done. But part of the reason that we have such a strong collaborative with growing interest and participation is really the structure. Thinking back, The concept for the collaborative began in 2019. Certainly work at the state level was in place well before that, but a summit kicked it off early 2020. Stakeholder volunteers came together to develop a framework, and then the action groups were identified by the feedback of those that attended those early collaborative meetings. And that really is the basis of where we are. But think about a strong family rectangular dinner table. What keeps that dinner table up are 4 strong legs. And looking at Brooke's slide, you can see the 4 strong legs of our collaborative. The collaborative, every single one of you that are gathered here today, those of you that started in 2020, those of you that have engaged in action group activity, and especially a warm welcome to those of you who are joining for your first time today. You are the absolute primary strong leg of our stakeholder-led initiative. Then we have the action groups focusing on the work that was identified, the compensation benefits, training, career advancement, and value and awareness. Those are still the 3 focus areas of the collaborative. I represent the work of the collaborative co-chair. I'm sort of the glue. I get the opportunity to connect with the state workforce team that Brooke identified, but I also have the opportunity of reaching out to those of you in different parts of the state with different groups and identifying some of the exciting work that are actively going on with our collaborative. And the 4th leg are state partners. They are our conveners. Without having the stability, the dependability of our state partners, we would not be able to function as effectively as we do. So again, thank you to each of you. The collaborative had a life before ARPA. Today, we're going to be focusing on some of the exciting work that is being done as a result of ARPA. But please remember, as a stakeholder-led initiative, our life will continue after ARPA, and our focus on the importance of the direct care workforce is not going to end in 2024. Next slide, Brooke. As any effective organization, you need to keep your mission and your vision clearly tuned in to the work that you're doing. As a result of needing to do some fine-tuning, the leadership of the action group chairs came together and tweaked, fine-tuned, didn't change, but fine-tuned the purpose and the vision for the collaborative. And for those of you that are just joining, this might be very, very helpful. The purpose, the Direct Care Workforce Collaborative, is dedicated to advancing the public's general awareness of the direct care workforce. That the collaborative advocates for improving compensation benefits, training and career advancement, and publicly recognizing the significant value of the direct care workforce in all healthcare sectors. Remember, we represent the continuum. Our vision, as we're looking forward, this is who we want to be. We envision consumers receiving high quality support and care from a strong workforce of skilled, qualified direct care workers who are well compensated, well trained, well respected, have the opportunities for advancement, and have highly sought after jobs that continue to continually attract new entrants and to retain those workers in our current direct care workforce. So a vision and a purpose and a mission that hopefully as stakeholders, we can all buy into. Brooke, take us to the next slide. Again, I just talked about the structure. Poor Brooke, I always go sort of off the grid.
I think I went backwards, so it's okay, Penny. No, that was me. No, that was me.
But we do have an exciting agenda talking about the opportunities and the work being done. So Brooke, lead us forward.
Absolutely. Thank you, Penny. We are so grateful to have you kind of leading this ship. Penny has been a great addition to the Direct Care Workforce Collaborative. She continues to be a partner for us in outreach. She's a motivator. We're really happy to have you, Penny. So thank you. Next up on our agenda, you'll see we have ARPA Initiative 1.02. We have invited a couple of our HICPUF staff, Rachel Newton and Sarah Hurley are here, to give us an overview of the work being done in that 1.02 initiative. I realize that I've been saying ARPA 100 times. That's American Rescue Plan Act. That is going to be really beneficial moving forward. So Rachel, are you ready to roll?
Yeah, can you hear me okay?
I sure can.
Okay, so hello everyone. Thanks so much for having me here today. As Brooke said, I'm Rachel Newton and I am the Quality Policy Specialist at the Office of Community Living. And so today I'm here to announce and discuss with you about the National Core Indicators, Aging and Disabilities launch of the Staff Stability Pilot Survey. And this will focus on providers who serve older adults and people with physical disabilities. And this provider survey will be used to collect valid and reliable provider reported data about the status of Colorado's direct care workforce. So we're really excited. Next slide, please. All right, so the agenda today is first I'm going to be talking about background information of the survey, such as why it's being developed, the foundation of the survey goals, the process of the survey, the topics that are going to be included in the survey, and who is included in the sample, who wasn't included in our sample, the timeline of this project, and then we will have time for any questions you may have. Next slide, please. Okay, so why is the staff stability survey being developed? So as we all know, there's a growing demand for direct care workers. We also know that COVID-19 had an impact on the workforce, and then also the previous lack of data tracking on this particular workforce. So the Staff Stability Aging and Disability Survey Project grew out of a desire from states and increased interest from the federal government for a reliable tool to capture state and national level data regarding the stability and quality of the workforce supporting older adults and people with physical disabilities. And so lessons learned from this pilot year will be applied to launch a survey which will be available for all states to participate in 2023. So I know Brooke was saying that this is ARPA funded, which initially HICPUF had wanted to use ARPA funding to develop this survey. However, Advancing States decided to do their own pilot. So instead we were able to participate in their pilot and we did not have to utilize ARPA funding for this. Next slide, please. Okay, so the foundation of the Staff Stability Survey. So this project is a collaborative effort between Advancing States, Human Services Research Institute, or HSRI, and the states that will pilot the new survey to gather information about the strengths, weaknesses, and trends of the direct care workforce. So this survey pilot is actually based on the Staff Stability Survey, which was first launched by NCI-IDD in 2014. And that survey examines the stability and quality of the direct care workforce, supporting adults with intellectual and developmental disabilities. So the current states that are participating in this pilot are Colorado, Indiana, Missouri, Washington, and Wisconsin. Next slide, please. So there are several goals we are looking to accomplish through the Staff Stability Survey. And those are, we hope to help establish workforce initiatives and government partnerships, measure improvements made through policy and or programmatic changes, provide baseline data for future analysis, and develop budget projections, initiate policy planning, identify areas for further investigation, and examine those workforce challenges. Next slide, please. So the process of launching this pilot is first the states created a list of providers with their emails, and they sent that to HSRI and advancing states. And then they put that into a portal and created a survey link for each provider. Then the states will be sending the link to each provider in an email. So if you are a part of that sample, you will be getting an email with that survey link. The provider will complete the survey utilizing their individualized link. And then HSRI and advancing states will de-identify the data, and then the state will have access to that data set for analysis, reporting, and policy development. And then lastly, the national data will be used to create a technical report by HSRI and advancing states. Next slide, please. So the topics that are included in the pilot survey, you will be collecting information on the demographics of the workforce, information on providers providing those supports in each stage, such as the size, the number of people served, and things like that. We'll also be looking at turnover rates, the length of employment, vacancy rates, hourly wages, benefits, and recruitment and retention strategies. Next slide, please. Okay, so who did we include in our sample for the pilot survey? So Colorado will be collecting data from agencies that provide services such as adult day services, respite, homemaker, personal care, and then you can also see the rest of those on that list right there. These services do have to be provided through agencies that serve the elderly, blind, and disabled, the community mental health supports, the complementary and integrative health, and the brain injury waivers. We have also included long-term home health agencies that provide basic and extended CNA services in our sample. Next slide, please. Who is not included in this survey? So in the survey sample, we did not include nursing home facilities, self-directed direct care workers. So that would be anybody that is participating in consumer directed services like CDOS. And then we also did not include clinically licensed staff such as physical therapists, occupational therapists, or registered nurses. But again, we did include CNA providers in our survey sample. Next slide, please. All right, so the project timeline. June and July of this year is when that survey pilot was finalized. And then again, we pulled our sample and sent that over to HSRI and advancing states. Also, that is when we started our AD survey cycle, the adult consumer survey cycle. September, so we will be launching this pilot here shortly. We will also be sending out a memo to announce that launch. And then we will have an October 31st, 2022 deadline for those survey responses. So it'll be pretty quick. In November through January is when the data analysis and review will occur. And then they will also be updating the survey for the final full launch and that development of the national technical report. And then in January through May 2023 is when that full survey launch will begin and data collection will begin for that next cycle. Next slide, please. Okay, so time for questions. So you can either put those questions in the chat or raise your hand. And Brooke, if it's okay with you, I'll have you call on people.
Absolutely, that sounds great. All right, looks like we do have one in the chat. Will you share what questions will be asked on the survey?
Sarah, do you know if we have a copy of what is going to be on that survey?
Yeah, so actually we can, when you get the survey link, you can actually download a PDF of the survey, because sometimes, you know, you may have to go through your HR files and kind of look at some stuff, and you don't have that all handy or just, you know, in your brain. And so you'll be able to do that. We can look at whether or not we could maybe get some of those questions and send them out. I don't know, because it's a proprietary document. They don't like us to put it, you know, the actual survey like on our website, but we will definitely check in with advancing states on whether we can get that information to you guys.
All right, looks like we have another question. Oh, it went away. Why were nursing homes not included?
I feel like Sarah is also better to answer this question for you all.
Yeah, so this survey is for home and community-based services waivers. So the direct care workforce that works in the community with our participants. And that is why nursing facilities were not included in the pilot for any states. It was not an option.
Perfect. And it looks like we have someone asking, I'm part of the CDOS program. Will this information in this survey be helpful to me?
Yeah, so I mean, one of the reasons why we decided not to actually pull consumer-directed services like CDOS is because we didn't want to skew the results of the data on wages and turnover rates. You know, with consumer-directed services like CDOS, you get to set those rates and stuff like that. However, we are developing and launching another survey for direct care workers. And I believe that CDOS will also be available to in this particular survey. And so that will be occurring in the fall and spring, and CDOS will be a part of that. So the reason why we just didn't include them in this one is just because we didn't want it to skew the results of the data on the wages and stuff like that. Is that helpful?
I will say that this is my plug for compensation and benefits group on Friday. We are having vital research come to the compensation and benefits group on Friday to talk more about that additional survey, not this one, but the one that will also be running as well, that will include CDOS and IHSS self-directed folks. So there's a plug for that. If you're not able to attend, notes will be posted. Lisa, did that answer your question?
It did. Yeah, can you hear me?
I sure can, yeah.
Yeah, it did, and I can see the part with the skewing for turnover and pay. Yeah, I can see why it wasn't included. But then let me ask, would some of this information be helpful to me regardless of being with CDOS?
Do you want me to answer that, Rachel?
Yeah.
Yeah, no, I think that I think all of this information is going to be really helpful for any worker who is directly providing care for individuals in the community, regardless of if it's agency-based or consumer-directed. We'll be able to see, you know, tenure, benefits. We'll be able to see the amount of, you know, pay, and all of that information. And so we're going to be able to use that, and hopefully that will be able to kind of transcribe to individuals who are participating in the CDOS program.
Great, thank you.
Perfect. All right. So I know there's quite a few coming in. I'm going to try to make sure I hit on all of them. Hope asks, I know that SNFs are not part of the survey ARPA. How will we address the speculated 1/3 of the SNF population needing least restrictive environments, 1/3 needing strong transitions program, and speculated 1/3 who need the SNF support? That might be a larger conversation, but do you guys have thoughts on that?
Sarah, if you don't mind chiming in on this one.
You know, I don't think that I can speak really well to this. So
you want me to jump in, Sarah?
Yes, please. I was like, I'm not the person. Yeah. Candace, go for it.
Sarah didn't want to call me out, but because she's too nice. So Hope, that's really helpful and a really great point. Obviously, nursing facilities are a huge component of the workforce, and there's a lot happening there. And we know that. While the ARPA funding, as we all know, cannot actually be targeted to the nursing facilities directly, most of our projects that are related to workforce are going to expand. The impact is going to be more than just HCBS. That's just not real. You can't say, this impact can only be limited to this small, tiny component. And so as far as, the transitions and, the other items that are needed within the nursing homes, I think those are additional conversations that need to continue to happen. And it'll be helpful in our other workforce projects to understand how can we ensure the impact is larger? How do we make sure that what we are doing is larger? And I will also put in a plug, as Penny mentioned, the collaborative is not isolated to just nursing facility or to just HCBS. That's only ARPA. The collaborative themselves is all workforce. And so this is a great opportunity for us as a group to come together to figure out how do we help bolster and lift up that area of the workforce as well as a group.
Perfect.
I
Thank
saw
you,
Hope
Candace.
gave me a thumbs up, so we're good.
Good to go. Okay, perfect. What future decisions will be driven by the results of this survey? And will these decisions be made at the state or federal level?
I don't know if Heather wants to jump in, as this is kind of in her area. Sorry, Heather. Now I'm just going to put people on the spot.
Just calling out everyone, Sarah. So, I mean, I wish that was a real easy question to answer, Lauren, but it is not. What we're really looking for is having, first of all, establishing a system for data collection. So we actually are understanding what we're asking of folks and what that data is that we're looking at, and then looking at relating that data to our initiatives that we are pushing through to see what is working and what is not working. It's going to be a little challenging this first year or so because we're doing so many different things, specifically ARPA related, right, with those projects. So it might be a little bit challenging to see what really has made the difference or not. But as we continue doing this, we will have the year after year after year data to kind of show in which initiatives are working. Where did we think we're going to have success and we didn't. Ultimately, our goal is to reduce turnover, increase retention, and I think we all know that retention is the best form of recruitment. So we wouldn't need to recruit so much if we can maintain people within the direct care workforce. So that's kind of our like a big overall goal with this. Once we kind of see what we are getting from this, and we can also see as a pilot state where we're at within our other states, and then as this ramps out into a broader, for all the states to participate, kind of where Colorado is with certain initiatives, where other states are with certain initiatives, and maybe where we might find success changing something, going a different path, and also where we might show success and be leaders to help other states get to our level with certain initiatives. So that's my broad answer to that one.
Thanks, Heather. And I'll just add on real quick if I can. I have to lower my hand first because I can't do both at the same time. But that's, I appreciate that, Heather. And the only thing I'll add on to that for the group, and obviously Lauren for the question, is, we need baseline data. We don't have baseline data. And so this gives us a place to start, and what we are going to do with that really determines what the data tells us, right? To Heather's point is we may think we're going one direction and the data comes in and we're like, oh, that is not where we need to go. So we don't have a definitive answer of exactly what we're going to do because we don't know what the data is going to tell us. And so that's the exciting thing, is really starting to gather this data so we can better understand our workforce, so that we can better then plan and help build up and do the things that are necessary to help with the recruitment, retention, all of those different policies. So this is really the initial baseline data gathering so that then we can build out strategies long-term going forward.
Perfect. Thank you, Candace. Dawn, I see that you asked, what about regional centers? Would you mind unmuting and just giving us a little more information on what you're asking, if you wouldn't mind?
Sure. The same as nursing homes. I was just curious if they were going to be wrapped up in, they are community-based, but they're not waiver. Well, part of us are waiver, actually.
They are not included in this go around, but I will say this, and maybe Rachel was going to say this at the end. We're piloting this, so please give us feedback. at the end of this for those that are participating, maybe for those who were not eligible to participate, because we're going to be giving that information to Advancing States and HSRI for the launch in 2023 for all states.
Perfect. All right. So just in the interest of time, I'm going to move us on here. Andrea, I see you have a question. Judy, Tom, and Lisa, we'll follow back around with those questions. We might also have time to come back to them in the open forum if we don't have a huge discussion there. So know that your questions will be answered. I'm just going to move us along in the agenda to make sure everyone has time. So, all right, Rachel, thank you very much.
Of course, thanks for having me. So again, this is my contact information. If you want to go ahead and send me, more questions about the pilot survey, feel free. That's my email. Also, Sarah, my supervisor, who has been so helpful with the questions, that is her contact information as well. And then this next slide, I just included a resources page for everyone. Yeah, there we go. So if you have any interest in the National Core Indicator surveys, I included some links here for you. You can go on and see what other surveys they have going on, what other surveys Colorado participates in. And then I did see a question pop up just about like what those reports would look like. If you go onto one of these websites, you can even go on and look at the staff stability. I put it there for the IDD. And so you can go in there and you can see the reports that were published for those. And so you can see where this is going to be headed.
Perfect. Thank you.
Yeah. Thanks so much.
All right, so moving us right along. Next up, we have our action group spotlight. I know for those of you that had been in several of our collaboratives before, we did just like a quick update from all 3 of our action groups, but our action groups are each doing a lot of really great work. And so we've decided to start spending a little more time in what they're doing and do a spotlight. So this month, we have the training and career advancement group. And so I'd like to have Lauren take it and talk a little bit about what y'all are doing and how you're working with standardized core curriculum.
All right, Brooke, thank you very much and good morning to everybody. As Brooke just indicated, I'll give a little bit of a background about the Training and Career Advancement Action Group, which again is one of the 3 action groups within the Direct Care Workforce Collaborative. So I'm Lauren Chevalier, founder and co-CEO of People Care Health Services. People Care is a Medicaid HCBS provider delivering in-home care for disabled children, the elderly, and income-qualified adults of all ages with long-term health conditions across the state of Colorado. And I also serve as co-chair of the Training and Career Advancement Action Group, along with my fellow co-chair, Chrissy Esposito from the Colorado Health Institute. So included in the new and updated Direct Care Workforce Collaborative vision and purpose statements that Penny reviewed earlier, there are references to 2 of the key elements of raising awareness and status of the direct care workforce. So those 2 elements being training and career advancement. So the Training and Career Advancement Action Group meets regularly to discuss prospective improvements to the training received by direct care workers and other ways to promote career advancement for those direct care workers. So the action group parallels 2 of the ARPA projects that you've been hearing about, and there are many that HCPF is spearheading, but the 2 that tie most closely to the Training and Career Advancement Action Group are training projects that the biggest one is the standardized training curriculum of core competencies, which are believed to be required for high quality home care service delivery. And the second of those 2 projects under our action group is being establishing career ladders that can lead direct care workers to higher levels of experience and progressively advanced roles and advanced levels of compensation within the healthcare system. So all of that is intended to further strengthen the career opportunities and support the workers who are currently in the direct care workforce, as well as continue to attract and retain those workers in the workforce. So among the topics that we've discussed in our meetings are related training projects for the direct care workforce in other states. So we can provide a list for those of you upon request of those projects. We don't have time to go through them in today's meeting, but upon request, we'll get that information to you. We've also discussed 8 key training success factors that have been identified as best practices in those direct care workforce training projects across the country. And again, don't have time to go through those today, but we can provide a list of those training success factors upon your request as well. So HCPF is now partnering with the University of Colorado, Colorado Springs, to build the standardized core training curriculum and to make it available online for the benefit of the direct care workers who serve Medicaid clients anywhere in Colorado. This is one of the projects that is funded by the federal ARPA funding to directly support the direct care workforce and support the Medicaid members who rely on that direct care workforce. UCCS is incorporating those training success factors into the development of this exciting new training resource for Colorado care workers. And we're fortunate here today to have with us Dr. Judy Scott, who is leading that project on behalf of UCCS to tell us more about the standardized core curriculum project. So with that, I'll hand it over to Judy.
Thank you, Lauren, for that introduction. I appreciate that. And you'll see that your co-chair, Penny Whitney, is very active in this project. And we have been working really in depth on getting an advisory team that can, across all the waiver populations, this same group that is in the collaborative, to make sure that we get the feedback that we need as we go forward with the standard core curriculum. And as Lauren said, we want to relieve the training burden, cost of training to agencies as they see fit to use this, what will be an open source standardized curriculum. Employers be able to point out to competency-based, person-centered training modules with test out options, reciprocity, flexibility, and portability. And employees will have the information they need for pursuing a direct care job with those portable and stackable credentials needed to provide high quality professional care. Penny and I are in conversation with community colleges and other higher ed institutions, as well as high school leaders, to see if these credentials can count toward the career pathway Lauren was talking about, with higher levels of certification, including CNA, LVN, RN, and so on. Much ARPA funding is focused on making sure that new workers can get the credentials. And so there's a great opportunity here to really ramp up the career pathway for direct care providers. Go ahead, Brooke, with the next slide. So if you were just thinking about getting a cup of coffee, I need you to stop here, because what we're going to do now is talk about the name for this curriculum. And we want everyone to weigh in here. And looking at who's in the meeting today, we should have some really interesting results. So, you know, what's in the name? Quite a bit, because we want it to refer to the training. We want it to be Colorado. Obviously, HCPF and UCCS agree that having an organic, resourced curriculum that reflects Colorado is better than having a canned or a paid for training. So we're excited to use our simulation center, our academic resources here, our educators, our aging center here at the university to come up with resources. We'll talk a little bit more about this, but we need to give it a name. So we have some choices, and Brooke's going to pop this up. We're not going to decide the name at this moment because it needs approval, but we will get back to you on what was chosen. Okay, Brooke.
All right, so I believe Heather Johnson just plopped a link in the chat. It'll take you to a Google form, which will give you the options that we're looking at for the different names. So take a few moments and hopefully Heather will give us some updates on how things are looking. I'm also going to put the names in the chat, just if you're having issues with a Google form for whatever reason, if you're on a mobile device and you can't toggle back and forth, we'll go ahead and put the names in the chat, and you feel free to just pick your favorite and put it in the chat and we'll make sure it's counted.
We're up to 28 responses. I'll tell y'all, if you like Colorado Care Training, it is far in the lead. I'm not going to say you can't vote twice, but if you have another favorite, you might want to click that link again.
Yes, Cody notes CCT is a nice acronym. You know, HICPUF, we love our acronyms. We love it.
I know we didn't play with the acronyms, so I like playing with acronyms too. And we need a tagline to go with this too.
Getting some good feedback in the chat. Thank y'all.
48 responses.
And again, you're welcome to vote in the chat as well. And I'll keep you posted, Heather, on how many we get through that as well.
Okay.
So while you're continuing to vote, why don't we go ahead to the next slide, Brooke? Okay, there we go. So I know many of you are just so eager to hear what the outline for the training curriculum is, and I'll give you a taste of it. One reason it is still outline form and not shareable, and will be shareable on the website as things get approved and we go module by module, is that we really need to have some listening groups throughout the fall so that we can really get a feel for what's going on. I'm really excited to see Rachel and Sarah's work on the survey. I think this will be informative for the curriculum and not just the demographics, but what's going on in training. But we need more granular information on what's going on. So the listening session is going to drive how this curriculum is delivered. I will tell you that I have 10 foundational skills models with the objectives of first describing the structure of care services and the role of the PCA as a member of the care team, which would be basic for all providers. Another 3 modules that incorporate the legal and ethical principles of PCA work into professional role development. And that includes things that I know are of concern. For example, communication skills, communication tools, including telephone communication, cultural concepts, what nonverbal communication looks like, boundaries, problem solving, and then professional steps that we all want to know about, what to wear, who to report to. I think a piece in there that I wanted to make sure was included in this very basic is the role of the personal care worker in understanding the reporting of complaints, protecting themselves, whistleblower protection, and so on, and confidentiality. And with those 10 modules, which should be able to be delivered by phone or by computer, and I'll stop here and say that there needs to be a piece of this training that actually may tell that tells step-by-step how to go through this training, how to use your cell phone to do it, how to use the computer to do it. And then an evaluation of language competency for that where ESL folks, people that English is a second language, can evaluate their ability to navigate this curriculum in English, or whether they need to be directed to other resources, other language resources, which are readily available for most videos. Most deliverables now can be delivered in several languages. And we need to know from our survey, what languages would be needed specifically. So getting people out the door on their feet, ready to go, can be done with these sets of modules in the very beginning. Moving on, we will add the responsible home care, clean environment, which may need to be done, or will need to be done within the first few days of employment. And then building on there, we have some higher level modules with, let's see. For example, building knowledge to support holistic consumer care, person-centered practice, care of older consumers, care of people with dementia or behavioral problems, and care of people with mental illness. So I'll stop here because I think it's pretty hard for you to take all that in, but I'm sure you'll have some questions. So our updated timeline, I'm going to stay right here on this slide, Brooke, will be to have our listening sessions throughout the rest of the fall, to be seeking from you training sites, train the trainers, personal care workers who want to give us feedback from listening, so that we can actually get out there and do pilots in the spring. But I don't have dates for you there. Our survey data will help drive this. Your survey data will help drive this process as well. Next slide. Thanks. There's our questions. I don't know how much time we have, Brooke. It may have to wait till the end, but I also have in these slides my contact information. I've been with UCCS now since 2016, and I have been a rehabilitation nurse specialist for something like 30 years, as well as an educator. And I love this work. It is so incredibly important. And I really look forward to being able to pull the curtain back as we develop this. We have a great academic specialist who's great with online programs, and she will help us decide what are the best modes of delivery. I have videos, I have checklists, I have test out options, I have all these, but I need an expert to work with us on this. So.
Perfect. Your contact information is up on the screen there, Judy. We do
Yes.
have a few minutes for questions, but I wanted to check in with Heather and see if she had some results for us, or at least and there are some good comments in the chat about, we want to be thoughtful about this and that. So certainly good feedback for us to have.
Okay, I found it. So we still with the most votes, like over 50% is Colorado Care Training. Second place, Prepare to Care. Third place, Colorado Care Training Colorado. All the other ones are pretty one or two votes on, and I believe there is some add-ons people have added in. Prepare to Serve Colorado Residents, Advancing Individual Careers, Health First Colorado Care Training. There's one there, that's real long, Direct Care Workforce Wholeness Model. And they have a really long acronym, DCWIM. I'm going to just make it into a word. So we've had 51 responses, which is quite great. I typically ask HICPUC folks not to vote. So thank you all for your feedback. Come to one of the future meetings and you'll learn what the new name is.
Perfect. Thank you. What questions do you have for Judy?
So
You're
Brooke,
welcome to
this is
raise.
Lauren. I've got a comment. And the comment is, Judy, thank you to you and your team for all the work that you're doing to build and prepare to put together the new standardized training curriculum and the system that will make this available to direct care workers and agencies across the state. One of the things that I'm excited about is the ability to streamline the repetitiveness that is currently part of the regulatory requirement for training for direct care workers today. And by that, I mean moving away from requiring the same small set of topics to be retrained over and over every year and every time a direct care worker moves from one agency to another. We know that they are learning and they are retaining, and they can prove through skills testing that they know the material. And so to move forward and build on that core training and allow them to build additional skill sets, that addresses the stackability that you mentioned, Judy. To be able to do that is going to be a huge positive, and to build certifications around that, so that the direct care workers can really use that as a springboard in their careers to take progressively more complicated and more advanced assignments. That supports the career path. So this is all very connected. It's very holistic within the training and career advancement arena. And I'm excited to see where we go with it next.
Thank you, Lauren. I'm seeing a couple questions in the chat. Do we have time?
Yeah, absolutely. Yeah.
Do you plan to use the system to help train direct care workers at UCCS? Their way to capture and recruit UCCS students into direct care careers. There's a huge need as aging parents cannot care for their adult children with disabilities. Thank you, Darlene. I agree with you. And I've taken that note to heart, because not only do we have students who do not ever consider the direct care work as a career, it's mostly because they don't know about it. And so, bringing this along with caring for older adults in long-term care, assisted living, and group homes, I think the whole package needs to be reflected back, and we need to put together something to inform our students. We will be using students for our simulations for the training itself. And I hope that helps, Darlene. And Heather, the good news, Heather Parga asked, will be funding available for DSPs to do these modules? Will it be like paying for a college course? This training is going to be housed by the state at HICPUC, and it will be free of charge. And so you imagine the direct service providers will be able to ask the PCA, go to the hub, get your credentials, show them to me, or show them to the next employer. So it'll be value added for providers, and of course for anyone taking the training. It will be free. And let's see.
Like Teresa has a question. This will be our last question, then we'll get moving on. Teresa asked, will this affect host home provider training?
Brooke, do you want me to jump in for that one?
Heather or Candace? Yes, please.
So thank you, Teresa. That's a great question. And at this point in time, it is not set to necessarily directly affect host home provider training, as this is targeted to personal care and homemaking tasks. However, there could be some real value add having consistent homemaker and personal care training for our host home providers. So as an aspect of your training, we know host homes provide far more than just those two services. So that is a great topic for continued conversation amongst the group and likely amongst our PASAs as well, to determine what would make the most sense and how it can be the most effective and useful for everybody.
Perfect. Thank you, Candace. Thank you, Judy. There are, looks like Hope has an additional question. If I can have someone just pop into chat and answer that for her, that would be great. And we'll get moving on here. All right. So next up, again, American Rescue Plan Act Project Directory and ARPA grants website. I'm going to go through this really quickly just to make up a little bit of time so we do have enough time for our open forum if we need it. So you have heard us talk about ARPA projects this entire meeting, but what we want to do is also turn you on to some of the other ARPA projects that are happening across the state and are happening with our other agencies and other departments as well. So you'll be seeing in the chat, we'll be dropping some websites. I'd like to call these Brooks bookmarks. I would bookmark these for you to continually go back and check out. These will be updated. You can continue to get information. If you're not coming to our action groups or the directory, we'll be able to show you what's going on in all these different projects. So the first one is just a screen grab from the overview of all the different projects. All of our projects are now active, which is really exciting. If you have specific questions, there's a question box there, and then you can go through each individual project to learn more about what is going on. So there's that one. Our stakeholder engagement calendar. This is where you'll find things like our training and career advancement action group meetings when we have Judy and UCCS come and talk to us about what's going on in these ARPA projects, when they're getting feedback and listening sessions and that kind of stuff. That'll be housed on this ARPA stakeholder engagement calendar. This will be a place where you can go and find the link, Zoom links, time, date, and any sort of sign up information if you need that. So that is also another great website to bookmark. And then along the left-hand side there, you'll see lots of different other links that I'd like to pull your attention to as well. The project directory, the grant opportunities, which I'm going to talk about next. And there's also a link on there to sign up for the ARPA Project Pulse newsletter, which will keep you up to date through your email inbox. The thing that we're most excited about is our ARPA grants website. Some of our projects, like a lot of others, are actually part and will have a grant application. So individuals are able to apply for grants. Individuals and providers are able to apply for grants to get money as part of this ARPA funding. And so one that is really near and dear to our hearts here at the Direct Care Workforce is the training fund. And so Heather, you were asking specifically about, are we going to have to pay for this training? Well, the standardized core curriculum will be free, but if you find another training that's beneficial to you as a direct care worker, but it is a cost, there is a cost associated with it, you'd be able to apply for additional funding to help pay for those costs. That's going to be for individuals as well as providers to complete training. But that's just an example of all the different kinds of grants that are going to be happening. This screen grab here will show you that there is some for respite care. There's another one that we learned about in our training and career advancement group on Friday. That's about helping HCBS providers purchase or get up to date with their technical telehealth with their electronics. You can apply for grant funding for that, which is really exciting. So this is a great website that we're going to plop in the chat. Again, it'll be continually updated. Some of these aren't active yet. You won't find the training fund one on here quite yet because it's still in the works, but they're coming up all the time. So potentially check that out every week or two to see what's coming up. And certainly we'll keep you informed in our collaborative and our action group meetings as well. My last plug, if you're not already signed up, is for John Barry's newsletter. You can get it from this ARPA homepage on the left-hand side. It would be on this here, but it's just a newsletter for OCL, which is Office of Community Living. And he does all of the stakeholder engagement, all the meetings that we have for HICPUF, and he does it twice a week. So it's a great way for you to keep in touch with us and what's going on with all of these projects. Whew, okay. that is all I got for that. So what I'd like to do is I'd like to open it up in our open forum. Again, this came to us from our survey we had in the collaborative in June. It was a suggestion to give the floor to attendees to be able to share their thoughts, ask questions of the group, share any resources if you know of trainings or webinars coming up that you're interested in, events. We'd like to kick it off today with Cody. Cody is an engaged member of all of our action groups as well as a collaborative today. And he was able to attend a conference in DC for the direct care workforce, HCBS workforce, I believe. I'll let Cody tell you the details, but we'd like to start with him. Cody, if you're ready.
Sure. Hi, everybody. I'm happy to see this level of participation from folks. Makes me happy. So last month in August, I was invited to speak on a panel with 4 other direct care workers at the Advancing States 38th Annual Home and Community-Based Services Conference. It was a really great opportunity to have a platform to voice our thoughts and experiences direct care workers in what we all know is a struggling and challenging industry. As a care worker myself and organizing with Colorado Care Workers Unite, I've made a lot of outreach calls and have had some really long conversations with present and former care workers, and I've become really aware of how isolated and muted a lot of care workers feel. So it's really great to have any opportunity to kind of, raise our voices. And I mean, I can see the potential of elevating the status and public perception of direct care workers to that of, something like emergency responders, firefighters, other healthcare professionals like doctors, nurses, physical and occupational therapists. A lot of care workers feel really left out and invisible in that way. One word to describe my experience at the conference is bizarre. It was I felt a little out of place kind of looking around. It was about 1,000 attendees, like administrators and policymakers, and I just couldn't help but feel that I have more in common with the hotel staff than I did with any of the attendees of the conference. So I had that in mind, and I shared some of that feedback with some of the administrators and attendees, and talked with the other co-workers. So it's just kind of with the nature of our work and how removed we are from a lot of policy work. I just couldn't help but feeling a little out of place. And there was a little lack of like guidance and preparedness. It was my first conference experience, and for several of the other care workers, and for one of the care workers, it was her first time ever even taking a flight on an airplane. So it was a lot of very new experiences for her. And the check-in process was a little, I think with any conference, organizing is going to be really difficult, and a lot of industries are feeling really stressed and understaffed. So trying to be mindful of, the organizational shortcomings, I guess. But like, we didn't get our hotel information, checked into the wrong place. I had to use my personal check card to make an authorization to receive my room key, which just felt, maybe a little unprofessional, but definitely put me in a weird spot. One of the other girls ended up having like overdraft charges to her checking account because they had to make $150 authorization twice for her and her sister staying in their room. I guess like some oversights maybe. So I've shared some of that feedback with the organizers of the conference, and I hope that we get more care workers invited back again. It seemed like the panel went over really well, and people were really positive and receptive to it, and really appreciative. I feel like the feedback that I got when people came up to me and like thanked me for my honesty, I felt like that was one of the best responses that I could have gotten from the people there, because it means that either other people in my situation have either been afraid to share their perception and their experiences, or just have not had the opportunity to voice those things. So being able to speak freely and openly and honestly about my experiences, my criticisms was really like ultimately positive feedback from everybody. So I guess going forward, if anybody is involved with advancing states, and again, I did share some feedback with them, just some more preparedness for people who might not be in the network of attending conferences regularly, and knowing what a registration experience is like and checking in. There was a lot of things like that that were kind of taken for granted. So overall, like, you know, we did feel like honored guests while we were there, and had a lot of other people come up and thank us, and it was great to be in the realm of people who are, you know, making policy decisions and moving millions of dollars around to try to improve the industry, when we're, you know, on the ground doing this direct work and spending hours and hours a day with the people that these policies ultimately affect. So I would hope in the future that there would be more, you know, involvement, and maybe even some of the intensiver things being designed around including care workers in some of those discussions that are happening. There was a lot of stuff that went way over my head. I mean, I was trying to keep a list of acronyms for everything, and I was just like, I can't keep up at some point. So I picked and chose a couple of sessions to sit in on. But yeah, like I said, ultimately great to have a platform, and I would love to see that continue. And I would encourage some more briefing and preparing for people, you know, and in positions who don't normally participate in these kinds of networking events and things like that.
Perfect. Thank you, Cody. I might have missed it, but did you say how many people were on the panel? How many direct care workers?
The panel was, it was 5 care workers. Yep. Yeah, it was 5 of us all together. One had like behavioral specialist training, and another one actually owns a home care agency and, you know, fills in, like, she's been a home care worker herself, now owns the agency. One of her clients is a member of Advancing States. And then there was myself from Colorado, and then 2 very young girls from Michigan. They were 19 and 21 years old. They had won the TikTok contest that Advancing States had put out, where they recorded like a day in the work. And it was really powerful to share that video during our panel, because it showed her, she went to 4 different houses, multiple residents in one day, filling medications, filling out paperwork, preparing meals, you know, providing like engagement community services too. And just, yeah, it really illustrated how much work we put into the jobs that we do. And yeah, having a good audience. The audience was very receptive to it. I'm sure a lot of people have heard really good feedback about us having that opportunity. So I would really love to see it continued.
Absolutely. Absolutely. Darlene asked, let me scroll up here. Did anyone bring the people they provide services for?
Yeah, there was one care worker who, like, again, her client is a member of Advancing States. Myself and the other 2 care workers were unable to figure, like, just logistically being able to bring clients and the healthcare needs that they have. Like, my 2 clients are paralyzed in wheelchairs, and one of them's on a ventilator and the other one's got a tracheostomy, and traveling with a Permobile like power wheelchair is just, my one client who's done that before, her wheelchair came back completely jacked up because they like turn it sideways when they load it onto the plane. It's not very conducive to traveling in general. So yeah, just difficult for us to be able to bring other clients. So that would be something to consider, is, you know, maybe bringing some other clients who are, you know, maybe able to travel a little more easily, but have really valuable experiences to share. Like, I know we've got some consumers that attend some of our, you know, action group meetings here and stuff. So that would definitely be something to consider as well.
Absolutely. Well, there's certainly some sentiments and some thank yous in the chat. I know that we'll probably continue to tap you to talk about this experience, because it's something that I think people are interested in, and I think it's something that we hope to continue, maybe even like on a state level, perhaps doing something similar. So
Yeah,
really grateful for you. I think that would be that would be awesome. So
yeah, I'm happy. I kind of felt like a little bit of a test subject going out. It was almost like a pilot program with it. And I talked with Colorado Care Workers Unite and like some of the SEIU union folks, and like they even mentioned, they're like, you know, we kind of feel like we dropped the ball on having an opportunity to prepare you for what the conference was really going to be. And like these two sisters went together. One care worker brought her husband, the other one had a client there. I was the only care worker who did not have like someone else of my status to be there with. And I just felt pretty isolated in my hotel room because of that. We all the care workers arrived on Sunday afternoon, and our panel was Tuesday afternoon. And there was no effort to connect any of the care workers together in those full 48 hours that we had been there. So we all met each other the morning of the panel, and that seemed like a missed opportunity for us to, you know, kind of relate and bond while we were there as well. But despite all of that, we pulled it together. And the one girl who was super nervous, like when we finished, she's like, oh, that wasn't so bad. But there was initially even some discouragement to allow us to use like note cards and some prompts for ourselves while we were there. And I kind of pushed back on that too. I was like, we're not public speakers. Like I've got a little experience myself, but like our job day to day is not speaking publicly to audiences. It's going into people's homes and providing like direct and nurturing care. Yeah, even some criticisms around like how the chairs were arranged on the stage, just having some more participation and input from the panel participants, I think would be really helpful.
well, I think we'll do our Colorado panel a little differently than it sounds
Yeah,
like.
sounds good. We can do it
Perfect.
good back home.
Perfect. Thank you, Cody. Lisa, I see you have your hand raised. I want to make sure we have time for you.
Yeah, hold on. It always takes me a minute to get through the little things, you know, the hands and et cetera on my phone. So no, I just wanted to make a quick comment. And I really appreciate what Cody just said. Actually, very interesting and well said and detailed. But I just wanted to comment on what I think the other person, and I can't remember, there's so many people, but what another person had said about some of the key things are the awareness and the status of direct care workers, and then the career advancement opportunity. I think that's an awesome thing. And then the career ladders to advanced roles. I thought, again, very interesting. I just kind of make a comment. And again, so my son's a high spinal cord injury. So spinal cord injury is what he is. He's 33. And so we were with an agency, and then the agency model didn't work well for us, so then moving to CDOS. But but a lot of what our direct care force looks like is everything that you guys are talking about too, for the most part. But we've also noticed too that a lot of times the caregivers feel, invisible, and they sometimes just don't feel like it's a real job. And we've also noticed that and as a result of like it maybe not always feeling like a real job, sometimes people, there's a feeling like they can how to say, not commit as they would another position. Like, for example, if it was a 9 to 5 with another company or something like that, there's a commitment that you feel, and you just don't call off or say, well, I can't come in this day because whatever. But it seems like the direct workforce, they have less commitment to what they're doing, and not everybody. Okay, please. I mean, that is not a factor throughout, because but we've kind of noticed some of those little oddities, that sometimes that commitment level isn't there, like it might be with a 9 to 5 job. So anyway, just comments. So
Thank you, Lisa. Any other comments while we have our open forum open? I want to make sure everyone got their questions answered too. I did look and it looked like Sarah and Rachel and Heather were answering questions throughout, Candace. So if you had a question that you didn't get answered, please let us know, raise your hand or put it in the chat, and we'll follow back around with those. But yeah, last call for open forum.
Brooke, it's Penny again. I just want to let everybody know that this is exactly the value of the collaborative. The idea, the insight, the honest feedback. This is why you literally, all of us, are the collaborative. The energized insight and opportunity and response today has been wonderful. And it really reinforces that a stakeholder-led initiative is the way to go. Thanks.
Thank you, Penny. Chrissy, I see you. Thank you. I almost forgot.
Thanks, Brooke. And I have my camera off today. I'm actually a little under the weather, but I dropped some information in the chat. But I just wanted to really alert folks of an ARPA grant. I know we've been talking a lot about ARPA grants that is coming up on October 3rd. I'm just the messenger. This is with HICPUF in the Office of Innovation Health. But if you are a HCBS provider that serves Medicaid members, or if you are a behavioral health provider that serves Medicaid members, there is a grant opportunity to receive up to $500,000 to upgrade your digital technology, which includes a lot of things like billing systems or client management systems, telehealth systems, devices and equipment to help with care coordination. The list goes on. I dropped a link in the chat. I'm happy to drop the link again. And I just think it's a really great opportunity. And I would love for folks to save the date for October 3rd when applications open.
Perfect. Thank you so much, Chrissy. All right, I'm going to go ahead and move us along then. We are getting towards the end of our time together. Thanks for hanging in here with us. So I'm just in closing, we're going to drop another link in the chat, and we'll include all these links too in the PowerPoint that gets posted to the website after the presentation. All of these links will be active, so you'll be able to go back into the PowerPoint and select all these links. But we would love for you to join us to be a member of our action groups. Our action groups meet every 2 months or every other month, I should say. So they're a little more often, and we get a lot of that ARPA stakeholder engagement, a lot more boots on the ground kind of information. It's just a really nice way to keep in touch with all the great things that are going on when we're not doing this collaborative. This collaborative can sometimes feel just like information dissemination, like we're throwing stuff at you, but certainly our action groups provide a lot more engagement, a lot more time to speak. They're much smaller groups, so we would love to have you join those with us as well. So we'll put the link in the chat for that. You can join one, you can join all three, you can just put it on your calendar and come join for a few minutes. You don't even have to sign up. If you just want to try us out, we're happy to do that as well. Our next collaborative meeting is going to be Wednesday, December 14th. How we're at the end of the year, I have no idea, but we're going to be same time, 10 to 11:30. Should be the same link you joined with today through Zoom, but certainly if you're interested in being put on the calendar invite, let me know. We'll put our HICPUF Direct Care Workforce email in the chat. And then we have information about the collaborative and all the upcoming meetings on our Direct Care Workforce website. And those, again, will be put in the chat, but when the PowerPoint goes out, they'll be active. And then my last plea for you, I even gave you an extra 5 minutes to take our 60-second survey. Like the open forum, that was a suggestion from an attendee from our last collaborative in June. I'm sorry, did I interrupt somebody? Okay, so from our last collaborative in June, we sent out this 60-second survey, feedback survey, to get people's feedback on what they want to see moving forward, what they'd like to hear from, how they'd like to interact, and that's how we implemented the open forum. We had several individuals ask for time to speak, and so we have a lot of flexibility in how we bring this collaborative to you, and so we take your feedback very seriously. So please, if you have time, take this survey. It's an open link, so if you don't have time to take it now, you can go back to it later, just save it somewhere. And like I said, we really have a lot of flexibility in the way that we do these. And so if something makes sense to bring it to you in a different way, we would be happy to explore that. So that's my final push. Penny, any parting words? Oh, 1 second, no. Penny. Lisa, I see your hand up, Lisa. Are you?
Oh, no, that's sorry, no, that was, I didn't put my hand back down. I apologize.
Oh, okay, perfect. No, that's fine. Okay, Penny, take it away.
I just want to once again express the participation of everyone. especially those of you that are new today. And Cody, thank you so much for raising the level of awareness of integrating the voices of those that actually are boots on the ground. We've got to do something about it, and we will with your leadership. So thank you. I look forward to seeing each of you in action groups, and we will see you at the end of the year. The work continues. Thank you.
Thank you all. I'll be here for a few minutes if you have parting thoughts. Otherwise, we'll see you next time. Thank you.